Hello, I'm Cindy Elliott with Esri, and I'm excited today to be joined by Andrew Schroeder from Direct Relief. Welcome, Andrew, and thank you for joining me today. Can you tell us a little bit more about the mission of Direct Relief?
Hi, Cindy. Thanks. So Direct Relief is a humanitarian medical NGO that supports local healthcare programs throughout the world with access to essential medicines and supplies. We make sure that people that are living in poverty and crisis throughout the world have access to those medicines and supplies.
Andrew, now with COVID-19, can you explain how Direct Relief's work has changed?
Direct Relief's role in COVID-19 has been to keep health workers safe and to make sure that the health system that the most vulnerable people in society depend on keeps functioning. So we've been distributing personal protective equipment. We've been supporting with access to intensive care unit medications, and then access to information that helps public agencies respond to the crisis in the most effective way possible.
I know you have a long history with Esri and GIS. Can you explain a bit how you use spatial analysis and GIS in the work that you do?
So we use GIS in everything that we do, actually. It's become integrated into all of Direct Relief. On the supply delivery portion, I mean, we're using GIS to be able to track our entire healthcare network throughout the world and make sure that, we're connecting all of the shipments that are being sent out in real time to accurate data about not only where they are, but who they're received by, all of the various attributes of those people that are receiving them.
Andrew, what are the next things, right? We're still in the middle of this crisis, despite having potentially reached the peak. The crisis still has a long tail. But what are you starting to see emerge or evolve in the trends that you're seeing?
In the United States, the big issue that we have to deal with is how societies reopen after the shock of having to place all these mobility restrictions in effect. Things like GIS play a really significant role in helping to plan that out. So mobility data, for instance, is one of these areas where we're going to have to be carefully monitoring where you're seeing rates of mobility come back online, where you're seeing people start to move around more, how that relates to the case counts in those areas, how different places are connected together for potential infectious spread as you sort of open up more of the society and get business back online and sort of try to reboot society.
And I think that's where the real value of GIS starts to play in, right? That it can have a macro global view, but really help kind of the analysis at the local level.
Absolutely. I think scale is one of the most important things that you learn in geography, and we look at that at the level of say how entire populations move and how they're able to practice distancing that will reduce the curve, but we also have to deliver a mask to a particular doctor in a particular place so that they can practice medicine and make sure that you're reducing the risk of their patients. If you don't do both of those things, then we're actually not going to effectively respond to this crisis.
I imagine you see a lot of really challenging and critical issues in the work that you do. Anything come to mind that's been inspirational for you in the last few weeks?
Yeah, I think this is one of the times that you see the best of people come out. Actually, I think one of the things that I've been most inspired by has been the offers of voluntary expertise. They've jumped in with helping us to create new projects like the analysis of human mobility as a part of the reduction of case counts as part of this viral spread.
That's so good to hear. I mean, that's what we should be doing, helping each other. Well, Andrew, thank you very much for your time today. And I look forward to following Direct Relief and the work that you're doing. It's just been phenomenal in helping those frontline workers and keeping them safe and healthy as well. Thank you very much.
Thanks very much.